So with the Delta variant burning through our population, with hospitals bursting at the seams, a couple of things that we're going to announce today to try to help. So we talked throughout the pandemic about the National Guard. They've been there to answer the call in so many ways, from vaccine clinics to other COVID response. They've helped at our food pantries and staffed our medical facilities, making sure that Kentuckians are safe and healthy. Last week, we also got the word, thank goodness, that federal approval to continue supporting our pandemic response through the Guard is going to continue at least through the end of this calendar year. In Kentucky, this means our Guardsmen and women will continue to suit up to help us fight the deadliest enemy, certainly in my lifetime. Current plans are we are going to initiate an operation on September the 1st. That's how long it takes to get people up and running, of dedicated National Guard, including a central command for our mission to help our hospitals. There'll be deployments in 2-week increments. The initial deployment will be 75 National Guard men and women. There'll be 5 teams of 15. Each will have 2 to 3 leads who will run an on-site operation. Our locations to start will be St. Clair Regional Medical Center in Moorhead. I hope while this won't fix things, it shows that we care and we want to help y'all if you're still watching. If you're not, I know you're helping people. Med Center Bowling Green are going to have 2 to 3 teams. Pikeville Regional Hospital, 1 to 2 teams. Teams will arrive 1 to 2 days early to get assignments, coordinate with the hospital and state liaisons. Other missions into the fall include mobile vaccination teams, supporting local health departments, and continued food bank support. Our National Guard has answered the call each time during this pandemic. We appreciate them. We are going to continue to work with them to provide support. But I want folks to know that a whole lot of what we're going to be able to do is additional hospital support. Most National Guard who are doctors or nurses are currently in one of these hospitals. And we're going to do our best to make sure that we're not taking resources from a hospital that is already struggling and just moving it. So a lot of what we're going to be able to do is the other support throughout the hospital, freeing people up to provide more of those services. So again, we know healthcare workers are tired, overworked, and under great stress. Our hospital systems are reaching capacity while patient needs continue to rise exponentially. In other surges, we have always made sure our healthcare systems have not been overrun. It's looking more and more likely that that's going to happen with this Delta variant, especially because the available pool of licensed healthcare providers has decreased due to attrition and just the incredible demand that's been placed on them. That's why we have submitted a resource request to the Federal Emergency Management Agency, FEMA, for additional healthcare professionals to help where we need them the most. We've requested 8 teams. Each team would include 8 registered nurses, 2 certified nursing assistants. We've also requested 2 EMS strike teams that would be able to transfer patients from a hospital that is full or doesn't have the level of care to another facility. Right now, our EMS is so strained, they're worried about doing regular emergency calls. We're looking at having some more help for them in just a second. If we get federal approval, the medical teams would support St. Clair, Pikeville Medical Center, St. Joe's London, Medical Center Bowling Green, and Baptist Health Hardin, just as a start, some areas that have been hit hardest. We have also, through a program called K-Beams, requested 3 additional teams of 5 ambulances apiece. This would help all of our local EMS and counties do regular emergency runs that either people can't do because of COVID or they're just so strained because of the extra COVID runs. We hope FEMA will approve this request quickly, but I do want to say we're not the only state going through this, and there are some states that right now are hit even harder than we are. So we'll await word. It was our job to ask and to push as hard as we can, and we hope we can get as much help as we can.